Hello, Healthy Choice Tribe. Welcome back to the channel. It is your health coach choice, Akubio, here again. So today we're just going to be explaining or buttressing on the different tests that every woman should carry out in 2025. If you have not seen that short, please go through the channel and look for it. You need to hear it, alright? So in this video, I'll just be explaining more on the different kinds of tests that every woman should carry out in 2025. Please like this video. Share it to a woman. Even if it is just one woman, share to her. She needs to be aware. Alright, then leave us a comment. When you like the video, it helps the algorithm to push it to other people that would need this information. It is so important. Thank you. Let's get into the video. A lot of women have been coming down with lumps, breast cancer, PCOS, ovarian cysts, infertility, and plenty issues. So while I made the video, someone suggested that I break these things down in simpler terms so that everybody that is watching could understand, right? So we're going to be taking them one at a time. In this particular video, we are going to be looking at hormonal profile test. So what is a hormonal profile test? In very simple terms, a hormonal profile test is a blood test that is done in a hospital laboratory where your hormones are checked for. So hormones are chemical messengers, right? They control how your body works. So whatever is happening in our body, there are chemical messengers that control how they work. Okay, so this is what a hormonal profile test is. So there's a thyroid hormone, progesterone, the estrogen, insulin. So all of these have their specific functions that they carry out in the body. So if one is out of balance, the body runs into trouble, and not until you bring it back into balance, things just begin to deteriorate in your body, so your health suffers. So a hormonal profile test just help you know, okay, this is the hormone in my body that is not balanced, and you will be able to treat on time. Hormones that you get tested for or that are displayed on your profile test could include estrogen, progesterone. Estrogen and progesterone are the female reproductive hormones. So this estrogen and progesterone, they are the hormones that are in charge of whatever is going on in a female's reproductive system. Okay, whether your eggs are quality or your ovary is not even producing eggs and all of that, like whatever is going on in the female reproductive organs, childbirth, the implantation of the embryo and all of that, progesterone and estrogen, they are in charge. All right, they are in charge. So a hormonal profile test shows you the amount in your body and also shows you that, okay, this is what you have, this is what it's supposed to be. Okay, so that is for a estrogen and progesterone. Then we have prolactin. Prolactin is that hormone that is in charge of lactation. So I don't know if you have seen women that have that produce milk even while they are not lactating, like they are not breastfeeding a child, but they are producing milk. So these women, their prolactin levels could be higher than normal. So if they go to the hospital and go for a hormonal profile test, they would be able to determine the levels of their prolactin, the amount of prolactin they have in their system, in their blood. All right, then next we have testosterone. Testosterone is a male hormone. All right, it is supposed to be dominant in male. So if it becomes dominant in a female, it is a problem. Okay, imagine as a woman, that thing that is making a man, the hormone that makes a man is not dominant in your own body. You know what that means already. So it is one of the hormones that the hormonal profile test reveals to you what amount it is. All right, it is supposed to be really small in a woman's body. Then your follicle stimulating and luteinizing hormones. Those two hormones control your ovulation and menstruation, your period and your ovulation. So if those two hormones are out of balance, you may be having issues with your ovulation or your period as well. So a hormonal profile test would reveal to you what is up with your follicle stimulating hormone and your luteinizing hormone. Then let's talk about the insulin. Insulin is also a hormone. Now, women that have been diagnosed with polycystic ovarian syndrome, which is PCOS, usually have high insulin levels. All right, so your insulin hormones usually in charge. They are in charge of controlling your blood sugar levels. So this hormonal profile test may also reveal that to you. Why is it important to carry out a hormonal profile as a woman? Number one, it will help you know why your periods are irregular. Okay, for those that are having irregular period, it will just help you detect that. Then it helps check for fertility issues. If you are going to be fertile when you marry, or if you are fertile, it will reveal to you. If you are not, it will also reveal that to you. So you can see how important this is. Then it also helps in diagnosing conditions like PCOS, which is polycystic ovary syndrome, then thyroid problems as well. So this is why a hormonal profile is very, very important. Let me know in the comments if you would do this test this year 2025. A pelvic scan is more like an imaging test, like a machine that is used to just look inside your organs. Okay, so it's able to see through your uterus, your ovaries, your fallopian tubes. So this test shows if there is the presence of fibroids, any cyst like ovarian cyst, PCOS, if there's just anything growing inside of you. This pelvic scan is able to detect it. It is also able to detect how the shape of your womb and the thickness of the uterine lining, that lining of your uterus, the walls. It's able to detect and show all of that. It also shows if you're pregnant or the development of your baby. So it shows that to you. Now, why do you need to carry out a pelvic scan? One, it is to check the cause of irregular period or heavy bleeding. So it is used to monitor pregnancy. It is also used to diagnose conditions like fibroid, PCOS, and ovarian cyst. So will you be carrying out a pelvic scan this year? Tell us in the comments. Now, the next test every woman should carry out, consider in 2025, is a mammogram. Okay, it's more like a breast examination test. So when you get to the lab or the center where they carry out a mammogram, they just put you on an X-ray. It's a specialized X-ray that determines if you have breast cancer. Okay, they'll go for a mammogram test, go for a breast examination. All right, now these hormonal imbalances here and there can put us at risk or predispose us to a lot of these health challenges. So the best you can do for yourself is get checked. Tell your neighbor, get checked. All right, so leave us a comment to know if you will be carrying out a mammogram this year. All right, please do so. It is for your own good. It is better you know on time. So other tests that you may want to carry out, in fact, on a more regular basis or on a more frequent levels, are your blood pressure and your sugar levels. Please always do this so that water no go pass garri. Thank you so much for watching this video. Please leave a comment, like it so that the algorithm can recommend to other people. Then share to a woman. Every woman needs this information. Personally, I have gotten a lot of women coming down with lumps, breast cancer. These women have irregular periods. A lot of them are on contraceptives. My sister, the best you can do is to share these videos for women. All right, go for a test. You that is listening to me right now, Pick one at a time. All right, pick one at a time and check. Okay, bye bye. See you next time.